Tēnā koutou katoa. Welcome to this module on Introduction to Psychological Health and Safety, Setting a Strategic Direction. My name's Dougal Sutherland. I'm a clinical psychologist at Umbrella Wellbeing. At Umbrella, we've been providing workplace wellbeing services for over 12 years, and we're really pleased to be partnering with the Government Health and Safety Lead in bringing you this module. So what are we going to cover today? Firstly, we're going to talk about the fundamentals. What is psychological health and safety? How does it relate to well-being? What are the words that we're using? I want to help you develop a common language and terminology for talking about this kind of stuff. Talk about the benefits, the why should I be paying attention to this? So the business case, the legal side of things, what's in it for you really as an organisation to be addressing this? And lastly, I'm going to talk to you about setting up a strategic direction, having a strategy that guides your plan to put in interventions and assistance for psychological health and safety in your workplace. Now, if you need any convincing about why you should be addressing mental health or psychological health and safety at work, there are three good reasons to do it. Firstly, it's the right thing to do. And the World Health Organization will tell you that. From an ethical perspective, we should be looking after the people that are working for us. Secondly, it makes smart financial sense. And I'll talk a little bit about that in a minute. But from a business perspective, it makes really good sense to invest in this area. And thirdly, it's the legal thing to do. In New Zealand, we have the Health and Safety at Work Act, and that actually puts obligations on you as an employer and as an organisation to be looking after not only the physical health, but the psychological health of people in your workplace.
Over recent years, there's been an uptick in psychological stress in workplaces. Now, many of those workplaces are ones that we would expect there, or you would naturally think that there might be high levels of psychological distress. Think first line responders, doctors, fire and emergency workers, police, who just in the everyday today of their business come into contact with situations and people which could lead to psychological distress or harm. But I urge you to think wider than that. Many organisations will have many things that can contribute to psychological distress or stress in their workers, whether that's through things like workload or burnout or boredom or unclear role description. There are a load of things in your workplace that could potentially be causing your workers psychological harm and distress. Now, when we talk about mental health at work, we all fall probably somewhere on this continuum, and we'll move about that on that continuum from day to day, week to week, month to month, year to year. That's okay. There are some people that will be suffering from some sort of mental health problem, a mental disorder, and they need support. Unfortunately, that's often where organisations limit their interventions to. We'll just provide EAP, or we'll just provide support when people are suffering harm. Now, that is certainly necessary, but I would say to you that is not sufficient to take account of your responsibilities in this space. You will have people that are what we might call languishing. That's when life is not feeling great at all. It's like all the air's gone out of your tires, but you're not clinically depressed. You just, woo. There's a good chunk of us who are probably just sitting in that middle space who are mentally doing okay, mental wellness. Then there's a group of people that might be flourishing. Life is going fantastically. I feel like I'm thriving. A comprehensive program or plan or strategy around psychological health and safety should take into account all of those aspects, all of those positions on that curve. What are you doing to help people flourish? What are you doing to support people to maintain going pretty well? What are you doing when people are slipping towards languishing or possibly burnout? And what do you do to support people when harm has occurred? Don't limit your interventions just to the when harm has occurred. Make sure they're covering all of those different phases of mental health. There are a whole bunch of different interventions or different types of assistance or different ways of supporting this work. And you can see in this on this chart that there's lots of different interventions, but they have different levels of effectiveness. All interventions are not created equally. I encourage you to zoom in on the slide and have a look and see what some of the, you might have put in some interventions in this space already. Have a look and see how they measure up in terms of their level of benefit that people will get from those. Often what we find at Umbrella working with organisations is people invest a lot in things that have, relatively minimal impact on people's lives, and they neglect the things that are actually have the biggest impact. Often because those bigger things seem a bit more complicated and a bit more difficult to do, and it's easier just to isolate it on the individuals that are suffering at this particular time. But I will encourage you very much to take much more of a broader systems approach to that. Now, there are a number of common frameworks and models that you can use and that you might be aware of in this space. There's the World Health Organization's model. Many of you might be familiar with the Business Leaders Health and Safety Forum's model. And some of you will be familiar with the UK model or the Government Health and Safety Lead model itself. The key point amongst all of these is that it doesn't matter too much which model you choose, but that organisations need to take a balanced approach to intervening in this area. So looking at where you're spending your money, on what you're doing, and making sure that it covers not just supporting people when they're distressed, but also in supporting people to flourish and to thrive and prevent psychological distress occurring in the first place.
At Umbrella, we like to think about psychological health and safety using that kind of pyramid approach that you can see on the screen in front of you now. At its very base level, we've got psychosocial safety. So that's what is your organisation doing in terms of policies, procedures, frameworks, all those kind of things. How do they support the psychological or mental health of our people? And that's a real fundamental. You need to have that in place. The next level up is psychological safety. That's how safe do I as an individual person feel about raising issues or raising concerns, knowing that people will have my back and that I'm not going to be punished for raising those concerns. Now, the concerns could be about anything. They could be about, hey, I actually made a mistake. I mucked things up and I'm comfortable putting my hand up, knowing that people will support me and will look at that and use it as a learning opportunity. It could be that I can put my hand up and say, hey, I'm not comfortable with some of the behavior that's going on in my workplace. It feels like bullying. Or it could be putting your hand up and saying, actually, mentally, I'm not doing so well at the moment. That comfort doing that, putting up your hand, is what we call psychological safety. It's another crucial part of psychological well-being at work, built on psychosocial safety. So remember, psychosocial safety is the policies and frameworks, and then the next level up is how safe do I feel as an individual. Together, we often refer to those two areas as mental safety at work. We know that if you have got good policies in place, if people are feeling psychologically safe, you are a long way towards reducing your psychosocial risks in the workplace and to promoting psychological health and safety at work.
I mentioned earlier that it makes good business sense to look after people's psychological safety at work. And I'm just going to give you some evidence and some information. You'll see on this slide there's some data about the number of days that are lost due to people being absent from work due to mental health problems. Those are absentee levels. And that's probably relatively easy to calculate, or could be relatively easy to calculate in your workplace, but you might have some data on that already. There's some hidden costs as well too. One of those is what we call presenteeism. Now, presenteeism is when you are physically at work, so that doesn't show up as an absence, as a sick leave, but productively you're not really there. You're functioning at kind of 50% or less. And we've probably all had times or days where you're doing that. It's like, oh God, I'm so busy worrying about something that I haven't really kind of focused on work much. You're still physically there, but you're just not projecting. That's presenteeism, and that can some researchers said that that's even more costly than absenteeism. It's just more difficult to manage, or sorry, to measure. Looking at the period of 21 to 22, KPMG, in association with the Human Rights Commission, looked at the estimated economic cost of one type of specific psychosocial or psychological risk, which was workplace bullying and harassment. Their estimate was that that was going to cost the country $1.3 billion per year. I don't say that to frighten you necessarily, but I do want to bring to your attention that it makes good business sense to be investing in this area, to save money. And actually, there's pretty robust research evidence that shows that money invested wisely in psychological health and safety, particularly in prevention, has a rate of return of about $4 to $5 for every dollar you spend. So it can really help with productivity in your organization. Let's take a quick look at the legal and regulatory environment that we operate in New Zealand. Hopefully, most of you are familiar with the fact that we have a Health and Safety at Work Act, which was introduced in 2015. One of the key things to note there is that that act defined health to include both physical and mental health. Australia has made some big advancements compared to New Zealand in this case, and we often look to our neighbours across the Tasman to see what they're doing. They certainly have a much more sophisticated and developed system of regulations and legal proceedings around this area. And it's an open question at this stage as to whether New Zealand will go down that route. We do know that WorkSafe investigates some of these work-related incidents, and they've introduced a Raise a Mentally Healthy Work Concern channel so that organisations and people within organisations can raise these concerns. People are increasingly seeking activity and redress through the Employment Relations Act. And so that's through things like the Employment Relations Authority and the employment courts, taking organisations to court around their failure to provide a psychologically healthy and safe workplace. There's also ACC, which covers some elements of mental harm that's incurred at work. Perhaps a big example or a nice example of taking a prosecution against an organisation in this space is the case of against the Board of Trustees at Melville High School. In summary, that was about 2 school counsellors who suffered from post-traumatic stress disorder due to the nature of their work. And they were ultimately awarded $1.7 million due to the psychological distress that they suffered. Schools aren't necessarily a place that you'd automatically think of which would have a high level of psychological distress. So I think it's a real warning sign to look at these sorts of cases and say, actually, how does our organisation measure up? In terms of the Health and Safety at Work Act, important to note that there are obligations at 4 levels of an organisation. Firstly, at an overall PCBU organisational level, there is the responsibility to set policies, procedures, rules, regulations in your workplace around psychological health and safety. The next level down, there are officers or executives who are responsible for implementing and seeing the implementation of those overall policies and procedures. Health and safety representatives, they have a role in bringing to the table concerns around psychological health and safety or mental distress. And lastly, there are workers or general staff, and of course everybody has some personal level of responsibility for making sure that they are operating in a way which supports and maintains their own psychological well-being. It doesn't just rely on the individual at the coalface taking responsibility, nor does it put it solely at the responsibility of the organisation. Each of those 4 areas has to make a contribution if we're going to see a really robust, psychologically safe and healthy workplace. Okay, so we have talked about what is psychological health and safety at work, why you should be paying attention to it as an organisation, where the term came from, what are my legislative responsibilities, etc., etc. Hopefully you're now in a position to say, okay, where do I start? What do I do now? Well, really useful, we think, to have a strategic direction. Now, your strategic direction is going to depend a lot upon you as an organisation, where you're at, and the size of your organisation. If you're really small, if you're an SME, you might not have a lot of resources as a huge, big organisation with thousands and thousands of people. But I think the key thing is to start somewhere. It's not enough just to say, oh gosh, it seemed all too big for us. And so we just focused on physical health and safety and ignored this other bit. I'm not sure that would cut the mustard if push came to shove. So I think the key thing is to start somewhere. What's realistic for you? A plan is not a strategy, and we strongly encourage organisations to have some sort of strategic direction. Often in our work at Umbrella, we see organisations who've taken a bit of a scattergun approach, and they've done a bit of this and they've done a bit of that. And look, that's great if that's where you're starting at. But as you move through to be a more mature organisation in the psychological health and safety space, you really need to have a strategic direction. And that involves having a vision. It involves identifying what are your critical opportunities, what are the issues that are going on for you, what are the key areas that you want to focus on. And if you're a government agency with office-bound workers, that's going to be quite different from somebody that's working in forestry, for example. So what are the key areas for your organisations? What are you wanting to achieve? What are your objectives? And how are you going to measure it? And I think that's a key thing. How do you measure your success going on? Once you have your strategy, your plan will fall out of that, or flow out of that, let's say, rather than fall out. So strategic direction is really important. And increasingly at Umbrella, we see organisations coming to us for support through that. How do we actually get some strategy? So we're giving you some tips here that you can get started with. In this slide, you'll see a nice example of a mentally healthy work strategy. And I'd suggest that you might like to pause the video here for a little time and have a look at it. You'll see, just talking to it briefly, you'll see that there's a vision that's got objectives, it's got key enablers, it's got measurement, and then it's got focus areas, and then it's got immediate action plans. So your strategic plan might be over a couple of years or even longer, but you want some immediate action plans that you're going to be doing, in the next 6 months and the next 12 months. Of course, you want to review them, and then you're going to go for the next 6-12 months. And of course, your plan might change over that time. But this is a really nice example of just an overall mentally healthy work strategy. Now, there are some key success factors that we know are really important if you're trying to set up a great strategy for mentally healthy or psychologically safe work. Firstly, crucial that the executive is on board. The number of organisations that we work with who say, hey, we've got this really great ideas, but they didn't quite come to fruition. And we say, why didn't they come to fruition? They say, because the exec wasn't really into it. It stopped at that level. So crucial for the executive and whatever the exec looks like in your organisation to be on board with this, and for somebody in the exec to be the sponsor, for the key person to take the lead in this space. Also, how do your metrics, how do your measurements align with the rest of your corporate strategy? What else are you doing? What else do you measure, particularly in the health and safety and wellbeing space? Get people involved, stakeholder engagement, and stakeholders is a flash name for people that are in your organisation, right? Get talking to health and safety reps and to people on the ground. And my strong encouragement to you is to get out of the boardroom, if you have a boardroom, and to go down to the coalface. Don't get those people at the coalface to come in. Go out to them, listen to them, engage with them, hear what they're saying, talk to the health and safety reps, find out what they're saying. But really crucial to be engaging and engage your leaders and managers, because often your leaders and your managers are the ones that are going to be doing this. They're going to be carrying this out. They're going to be the ones who are right at the forefront of putting this into play. Capability and development. Do you have the capability to do this in-house, or are you going to have to get extra support in? If it's a new area for you, you may well need to get extra support in. Some organisations have wellbeing teams or health and safety teams that include mental health. You may already be there, but if not, you might have to get extra support in. Doesn't have to be paid for. It might be that you learn from friendly colleagues or other organisations that you work with. Be clear about what everybody's role is, and that will come from strategy. And lastly, make sure you communicate what you're doing really clearly. Transparency and clarity of communication is really important. And it's okay for you to put up your hand and say, hey, we didn't get this right, we're trying it again. In fact, it demonstrates what we'd call good psychological safety, which is that ability to model making mistakes and saying, I didn't quite get this right, and I'm putting my hand up to say that. So key success factors, make sure that you are paying attention to each of those, because if you do that, you're setting yourself up to win. Also important to embed your strategy into business activity. And there's lots of layers here. There's layers of governance. You've got policies around education, proactive risk management, detection and support. And then you've got enablers as well. Capability, what are you reporting and measuring? What are your roles and responsibilities? So try as much as possible to embed your strategy into the business activity. Don't let it be standing alone out here. Make sure that it's completely encompassed within, if that's at all possible. To assist you even further, I'm sharing with you our Umbrella Wellbeing model of the core or the key focus areas for psychological health and safety. Now, we haven't just made these up. They actually align with the ISO standards, ISO 45003, which breaks work into three broad areas. Social factors, and those are things like leadership and social support. Task factors, those things that are associated with the job itself, and then broader organisational factors. We have also added in individual factors because we think it's super important to also be taking into account an individual's own psychological or mental health status, because that can have a big impact. So if somebody's got their own history of depression or anxiety, for example, they will bring that to work, just like they might bring to work a physical injury. And you can see in this slide that there is there's 12 different factors once we've broken them all down. So again, you might want to pause this slide and have a more in-depth look at this. Exactly what are the areas that we want to focus on? And having this sense of what you want to focus on should help you with, okay, what are we going to do? What are we going to do next? Or what are we going to focus on first? But I think it's really important for you to assess each of those 12 different areas. Now, you don't have to do this alone, okay? Sometimes, especially if you're new to the area, it can feel a bit overwhelming. It's like, oh gosh, there's so much stuff and I really don't know. I don't know where to start. And I know that some organizations go, it just feels so overwhelming. I'm just not going to do anything. I'm going to put it on the back burner. We're not ready for that. Well, you'll be ready, or hopefully you don't have to wait till your people are psychologically harmed before you're ready. It would be great to get in and prevent that from happening in the first place. Now, there's lots of resources available. You can see here on this slide, there's a whole list of resources that you can click on. Government Health and Safety Lead, Umbrella Wellbeing, WorkSafe, Business Leaders Health and Safety Forum, Massey, a whole heap of them, a whole raft of them. So take some time, set aside some time and actually look at resources that are available. Don't feel like you have to do this all on your own or that there's nobody else there. Our experience at Umbrella is that lots of organizations are probably in the same place as you, just in the sort of beginning to middle stages of psychological safety. Okay, so there's nothing wrong with you. It's quite normal. But you don't have to do it alone. That's the great thing. You can reach out and get support from a whole lot of different resources. A lot of those resources will not cost you anything. So winding up this module, we've talked around what is psychological health and safety. What do we actually mean and how does that relate back to wellbeing? We talked about the New Zealand context. We talked about the New Zealand legislation. We talked about things like WorkSafe and their role in it as well. I think we gave you some common models that you could use for thinking about psychological health and safety at work, and particularly wanting to emphasize the need to focus not only at the ambulance at the bottom of the cliff, but in preventing harm in the first place, and even helping people to flourish and thrive. As somebody once said to me at a workshop, actually, work should be something I enjoy doing and I come away feeling energized and enthused about it. Wouldn't that be amazing? That would be in the flourishing end of things. So don't think that all your interventions have to be down there, the ambulance at the bottom of the cliff. Way more benefit, and we know this from the psychological research, about putting resources and investment into the flourishing and prevention side of things. We talked about a business case around how, from a business point of view, it makes sense legally and financially to pay attention to psychological health and safety. And we talked about some of the regulations and the court rulings that have come down recently that are really, I guess I'd think of those as a bit like the stick that are saying, hey, you better do this, otherwise you'll get into trouble. Sticks have their place, but it's much better to work for a carrot than a stick. So I encourage you to take a really proactive approach in this. And lastly, we talked about how to set a strategic direction. And I encourage you to think broadly about having a strategy for how you're going to approach psychological health and safety at work. You may have done one or two things, had a guest speaker or done, something for anti-bullying day or whatever it is. And that's cool. There's nothing wrong with that at all. Good place to start, and you must start somewhere. But ideally, you'd have an overall strategy that leads to a comprehensive long-term plan, and out of that plan will fall particular actions that you can perform over the next 6 to 12 months. You review them, the next stage, etc., etc.